Hey, I'm Molly from the Forest Bathing Society and Project Rewild Canada. Welcome to the role of nature therapy in palliative care. This is comfort and connection. In palliative care, where the focus is on providing comfort and improving quality of life for patients with serious or terminal conditions, nature therapy offers a unique and compassionate approach. Nature's calming, grounding presence can help alleviate pain, reduce anxiety, and create moments of peace and connection during this critical time. As a nature therapist working in the palliative space, one of the most common questions I get asked is, how can nature therapy ease pain? Well, there's a few different ways this works. One of the first ways is by promoting relaxation and reducing stress. Nature therapy helps alleviate the body's relaxation response, which can reduce muscle tension and physical discomfort. Being in nature has been shown to lower our levels of the stress hormone cortisol, which can ease pain and provide a soothing, calming environment for patients in palliative care. Another way this works is by distracting the brain from pain. Engaging with the natural world, whether it's through observing the trees, listening to the birds, or feeling the breeze, can act as a very powerful distraction from pain. This shift in focus from internal discomfort to the sensory experience of being in nature can help alleviate the perception of pain, offering moments of relief. Third way is by enhancing the body's natural pain relief. Time spent in nature encourages deep breathing, which can activate the body's parasympathetic nervous system. This can help promote the release of endorphins, the body's natural painkillers. You know that feeling, that runner's high you get? Yeah, that's endorphins. So the calming effect of being in nature can also reduce the emotional toll of being in pain, helping patients manage both physical and mental discomfort. One of the fourth ways this works is by supporting the mind and body connection. Forest therapy encourages mindfulness and awareness of the body in the present moment, which can lead to improved pain management. Focusing on the breath, focusing on the sensations in the body, and focusing on the surrounding environment helps patients feel more in control and grounded, easing both physical pain and emotional distress. Another really common question I get asked is, can forest bathing improve quality of life for terminal patients? First off, this is a great question, and this is a super important question. Short answer, yes. Longer answer, let me show you how. Number one, it offers a sense of peace and a sense of calm. For terminal patients, the natural world can offer a profound sense of peace and acceptance. Forest bathing invites patients to slow down and connect with nature in a deeply meaningful way, fostering feelings of calm and comfort in the face of serious illness. The powerful, peaceful environment can provide respite from the clinical environment of hospitals and hospice care. Second way this works is by reducing anxiety and depression. Terminal patients often experience high levels of anxiety, fear, or depression, and nature therapy has been shown to help alleviate some of these symptoms. The serene environment of a forest, with its soothing sounds and fresh air, promotes relaxation and emotional balance, improving our overall mental well-being. Third way this works is by increasing feelings of connection. Forest bathing nurtures a sense of connection to the natural world and the more than human world, which can provide comfort to those nearing the end of their life. Patients may feel a deep bond with the earth, with the plants, with wildlife and other beings, creating a feeling of being part of something larger than themselves. This connection can bring comfort, especially for those grappling with existential concerns or fear of what happens next. Another great thing that happens is it provides emotional and spiritual support. Now, this is important not just for patients in palliative care, but for their caregivers and their support system as well. The quiet, reflective nature of forest therapy encourages moments of introspection, allowing terminal patients to process their thoughts and emotions in a gentle and supportive environment. Nature's cycles of life and renewal can often offer spiritual solace, helping patients come to terms with their condition in a peaceful way, on their own terms, and in their own time. Another great question I get asked quite often is about indoor nature therapy options for bedridden patients. This is something I am personally incredibly passionate about. So yes, there are options. Let's talk about them. First thing I want you to focus on is nature sounds and visuals. For bedridden patients, nature therapy can still be experienced indoors through the use of nature sounds, like rain sounds, ocean waves, bird songs. Combine this with some visual elements, like nature documentaries, photos or videos of forests, or mountains, or gardens. These sensory inputs can create a calming atmosphere, can bring the essence of nature inside. Especially if you're in one of those sterile feeling hospital rooms. Another thing you can do is focus on indoor gardens and plants. Incorporating potted plants, flowers, or small indoor gardens can help bedridden patients connect with nature. The simple act of seeing greenery, smelling flowers, or feeling the texture of leaves can evoke the sensory experience of being outside, promoting feelings of relaxation and well-being. Another thing I am a huge advocate for is natural light and fresh air. Positioning patients near windows that allow for natural light and views of trees or the sky can also create a connection with nature. If possible, opening windows to let in the fresh air can further enhance this experience, helping patients feel closer to the outdoors, even from their beds. Another thing you can do is guided meditations and guided visualizations. Patients can engage in nature therapy through guided visualization exercises, where they are led to imagine peaceful, natural scenes like a forest, a beach, or a meadow. These mental exercises tap into the calming effects of nature and provide a sense of escape from their physical limitations or their environment. Number 5 is nature-themed sensory objects. Simple items like smooth stones or a pine cone or a piece of bark can be used as sensory tools for patients to touch and to hold. These natural objects bring the physical sensations of nature into their space, creating a tactile connection to the outdoors. Nature therapy, whether practiced indoors or outdoors with adaptations or modifications, can offer significant comfort and connection to patients in palliative care. By easing pain, by reducing anxiety, and by providing a sense of peace, it enhances quality of life and it helps patients find solace during their journey. Now, if you or someone you love would love to try forest bathing for yourself, I recommend starting with a rewild session. It's an audio meditation we give you absolutely free. You can sign up at the links below. You can take that meditation out to your front yard, your backyard, your local park or forest, or hey, you can do it inside with a nice view from your window as well. It'll take you through a variety of invitations and things to do to engage those senses. Gives you just a taste of what we do in the rewild world. It'll be enough to answer a little bit more of your questions. And if you want to connect more, you can find all of our social links down below as well. And if you want to contact us, that link's down in there as well. Thank you so much for joining me today. I'll see you in the forest. Remember, I love you. And I'll see you out there.